Okay, so Claire and I are both physical therapists, and we often don't get to see people in that acute phase. And so when people think of physical therapy, they usually think about it for pain and aches that aren't going away. Well, acute pain and spasms happen all the time. And so I want to go over my top 2 stretches for that acute spasm-like discomfort that you may classify as throwing your back out, or you did something and you literally can't move, like you're stuck. You feel like you just can't get through your day. You don't know what to do. Well, if you're looking for a couple stretches to help you through that, these are the stretches for you. These are the ones that we like to use, and we're going to teach you what it should feel like to get through that stickiness, that spasm-like discomfort. Here we go. Okay, so you guys have that spasm-like discomfort, you just can't move, something happened, and your back is locked up, or you feel like you threw it out. Well, one, you might want to consider getting an examination. If you have persistent symptoms with symptoms down your leg and you're having weird symptoms related to bowel or bladder or what we call red flags, 99% of the time that stuff doesn't happen, but we tend to think that we need an MRI or advanced imaging when we have that acute-like discomfort. And unfortunately, sometimes you just have to wait it out. Your body is a great machine. It will heal. You just have to give it time and gentle movement. So you're giving it some time, and we're going to show you that gentle movement. So we're going to work through the different abilities of your lumbar spine when you're feeling that sharp discomfort in your back, that spasm-like discomfort. We're going to work through flexion and extension, and then we're going to do a tiny bit of rotation. So those are the primary movements of our lower back. We want to restore those movements, but we want to listen to your body along the way. So listening to your body is key, and so we don't want to cause an increase in discomfort, but we want to flirt with that area that is a little uncomfortable. So the first one here is going to be knees to chest, and if your pain is really uncomfortable and you have spasm-like discomfort, you're definitely going to want to start with just one leg. And so Claire here is going to grab one knee and gently pull it to her chest. Now the other leg can be bent up or straight, really your call. We found that if you're really uncomfortable, bend tends to be a little bit better. And if she's really uncomfortable, she may not pull very far. That may be enough for her, or she may come to the side and pull it more, or she may come inward and pull it more. It's really dependent on your body and what you're feeling. Let's look at the other side here. This works on that flexion moment of your lumbar spine, and so that ability to bend forward or sit in a chair, that tends to be more flexion based. And she is just going to pull. Now, if she had a lot of discomfort, it may just be in this range right here, and that's okay. That's absolutely okay. Every day should be better and better, but you just have to keep trying and get after it. And so the knees to chest can be one leg or both, and the range of motion is really dependent person to person and on your discomfort. You should feel this in the back of your body, in your hips or your lower back, and really nowhere else. If you feel it in your groin or your hip area, then you just want to adjust your range of motion. It just could be the way that you're built. And now we're going to work into lumbar rotation. So we just worked on the flexion. Now we're going to work on the rotation. And so very comfortable position. When you're feeling that spasm-like discomfort, you may just start with rotating a little bit in each direction. Motion is lotion when it comes to your lower back. And so you want to relieve that spasm-like discomfort. You can also do classic things like heat. I have a video on ice or heat as well. But you can just rotate side to side. Now, the further you go isn't necessarily better, but as you start to get better, you'll be able to go further. And so you just want to enjoy that good stretch as you start to loosen up. Now, how many times you do that? Well, this is pretty easy to do. Your back could do this all day long if you wanted it to. So I usually recommend 4 or 5 times a day, trying to get into those positions to relieve that lower back, especially if you're having a hard time walking or getting around. Let's say you had to miss work, or you just can't do the things that you want to do in the day or what you normally do. These are great things that you can be doing on your own to help relieve some of that discomfort. So motion is lotion. You want to move your lower back, you want to move those back muscles, but you want to listen to your body along the way. We can't stress that enough. When you have high tissue irritability, which means you're really uncomfortable, you don't want to be doing too much because you don't want to make yourself worse. That's the biggest thing that we hear is why didn't people do things? It's because they're fearful of making themselves worse. So I'm telling you, listen to your body, and something is way better than nothing. So listen to your body, take it easy, keep moving, it will get better. And if you guys ever have any questions or comments, please leave them below the description. And if you like what we're putting out there, please subscribe. Otherwise, as always, stay healthy, keep moving, and take care of yourself.